Dear brothers and sisters, I welcome you all to hear and see this video message. This article I made on 10th August 2021 on COVID-19 period. This article suggestion I sent to Union Government at citizen portal mygovernment.in. Content for this video I given in the description. This content for this private sector dependency should be downsized to prevent deaths of lives and to save the people. The government infrastructure, that is government hospitals and infrastructure, and then budgetary expenses for government hospitals should be increasing. Nowadays the people for health facilities, they mostly approach the private hospitals rather than government. 70% of people and that 70% of the infrastructure lies with private hospitals in India. This should be prevented. The private sector dependency should be downsized. The only assured way to prepare for any subsequent COVID wave in India is to strengthen the entire health system. Nearly 80% of Indians who died of COVID has had existing conditions like diabetes, heart disease and other comorbidities. Even pre-COVID, 80% of deaths in India were due to non-communicable disease and their complications. The pandemic has shown that it cannot rely on the private sector to compensate for public health. The government vaccination policy has reserved a 25% of quota for the private sector, but analysis of actual inoculation till 30th May 2021 shows that private centers account for barely 7.5% of the total doses administered. In almost 80% of the districts in India, the public sectors provided more than 95% of all vaccination doses so far as on 30th May 2021. The private sector share is less than even 1% in half the districts, especially in predominantly rural areas and in the northeast. Also in Gujarat, Amul Milk Federation Company installed the oxygen generated plants within 3 days to supply oxygen 35 to 40 patients per day. But the corporate private hospitals not willing to install oxygen generating plant. So rural India almost entirely depend on government for COVID vaccination. This raises the question of how giving the private sector such a big role is supposed to spur vaccination as argued by the center.